The $300 compounded Ozempic you have been getting is about to become illegal. The FDA confirmed that the Semaglutide and tirzepatide shortages are officially over. That decision triggers a legal change that affects hundreds of thousands of people. Here's what it means. Compounding pharmacies can legally make copies of FDA-approved drugs only when those drugs are listed on the FDA shortage list. While semaglutide and tirzepatide were in shortage, compounding pharmacies and outsourcing facilities could produce and sell compounded versions. That is why you could get semaglutide for $200 to $400 a month through telehealth platforms instead of paying $900 to $1,000 for brand name Ozempic or Wegovy. The shortage made it legal. The end of the shortage makes it illegal. The FDA has been signaling this shift for months. In late 2025, the agency removed tirzepatide from the shortage list. Compounding pharmacies sued, arguing the shortage was not actually resolved. A federal court temporarily blocked enforcement. But by early 2026, the FDA confirmed both semaglutide and tirzepatide shortages were resolved based on manufacturer production data. The legal window for compounding is now closing. Outsourcing facilities, which are the larger compounding operations, have 60 days to stop production. State-licensed compounding pharmacies have tighter restrictions and face enforcement action if they continue. What happens to the people currently using compounded GLP-1s? That is the real question. Estimates suggest between 500,000 and 1 million patients in the United States were accessing semaglutide or tirzepatide through compounding at some point in 2025. Many of them cannot afford brand name prices. Ozempic retails around $930 per month without insurance. Wegovy is about $1,350. Even with manufacturer savings cards, out-of-pocket costs often exceed $350 per month. Compounded versions were filling a real access gap. Some patients will transition to brand-name drugs if their insurance covers it. Medicare Part D now covers GLP-1s for obesity in some plans, which is new in 2026. Commercial insurance coverage varies widely. Patients with prior authorization requirements face delays. Others simply cannot afford the brand name price and will stop treatment entirely. Telehealth companies that built their business models around compounded GLP-1s are pivoting. Some are shifting to other weight management medications. Others are exploring partnerships with brand manufacturers for discounted access programs. A few are closing their GLP-1 offerings entirely. There are safety concerns too. During the shortage compounding era, some operations produced substandard or contaminated products. The FDA issued warning letters to several facilities in 2025 for purity failures and incorrect dosing. Not all compounded GLP-1s were problematic, but the quality variance was real. Patients switching to brand-name drugs get the consistency of FDA-regulated manufacturing. They also get the price tag. What should you do if you are currently on a compounded GLP-1? First, do not stop abruptly. That can cause rebound appetite and rapid weight regain. Second, talk with your prescriber about transitioning to a brand name option. Check your insurance coverage now, before the compounding supply disappears. Manufacturer savings cards for Ozempic and Wegovy can reduce costs, but have eligibility restrictions. Third, watch for communication from your telehealth provider. Most are sending transition guidance to current patients. If your provider has not contacted you, reach out proactively. The compounding era gave access to people who otherwise could not afford GLP-1 treatment. That access is ending. The drugs will still exist. The question is who can get them. Talk with your clinician before making any medication changes. For plain language GLP-1 updates, visit theglpspot.com.